Hi, my name is Desiree Valdez, and today I'm going to be discussing the knee. So, the bones that make up the knee are going to be the femur, which is the thigh bone and the longest bone in the body. We have the patella, which is the kneecap, the tibia, which is the shin, and the fibula, which is the calf. In this image, it does cut off at a certain point, but we do see the end of the femur, the beginning of the tibia and fibula, and the patella as a whole because it is small. The patella is kind of like a circular shaped bone. Of course, there's some distortion and it even comes to a point. So it's not a perfect circle, but it is very much a cap. We also have the joints of the knee. So the tibiofemoral joint is going to be between the femur and the tibia. It is classified as a modified hinge synovial joint. The blue indicates the synovial joint. Um, we definitely need synovial fluid between the bones because that helps lubricate the bones and reduces the friction. If we did not have it, there would be bone against bone. It would be very painful. And we quite literally need the fluid. Um, that hinge joint is going to be important as well. A hinge joint just means it's on a directional plane, one directional plane, and for the knee, it's going up and down, which is extension and flexion, which we're also going to refer to as bending and straightening. Um, and furthermore, there's going to be the patellofemoral joint. So that's going to be between the femur and the patella. That is just going to be a synovial joint. The knee as a whole is a hinge joint, but the patellofemoral joint is just a synovial joint. So that means, indicated by the yellow, that there's just synovial fluid between the femur and the patella, which makes it easy for that patella to glide along the end of the femur as we bend the knee. As for the tibiofemoral joint's purpose, that is to endure the weight of the body. As I've said before, it is classified as a hinge joint. Therefore, it gives the knee the ability to bend and straighten, which is extend and flex. And for the patellofemoral joint, it allows for the patella to glide along the end of the femur, especially when bending the knee. There are other things that aid in the extension and flexion, like the quadriceps or other muscles. As we talk about muscles, there are two groups that make up the knee. The quadriceps are anterior muscles of the thigh, which anterior just means like the front. Their purpose is to straighten the knee, whereas hamstrings are posterior to the thigh, which is the back of the thigh. Their purpose is to bend the knee. We also have another group. They all perform the same functions. So we have the gastrocnemius, which is the calf muscle. That just helps with flexion. The popliteus is behind the knee. That also helps with flexion. There's the sartorius and the gracilis, which again helps with flexion and rotation. As for the ligaments that make up the knee, we do have a lot of the same functions. These ligaments essentially all provide stability. The anterior cruciate ligament, which is highlighted in blue in this image, that is to keep the alignment of the femur and the tibia and prevent hyperextension and excessive rotation. Um, of course, it is possible to hyperextend and excessively rotate. Um, and it is possible to misalign, but it's as preventative as it can be. The posterior cruciate ligament also does the same thing. Um, if it By misalignment, I mean the femur and the tibia, they glide away from each other. The lateral meniscus and the medial meniscus also perform the same functions, so that provides stability as well. They mostly absorb the impact that we put on the knee by our weight as we walk or we bend. So they're there to absorb. Um, so we also have the lateral collateral ligament and the medial collateral ligament. Again, stability. Number one thing is stability with all these ligaments. Um, they also prevent misalignment as well. As you can see, the lateral collateral ligament is attaching the femur to the fibula, whereas the medial collateral ligament attaches the femur to the tibia. So they're on the sides of the knee and they're making sure that they don't move, like the femur doesn't slide off to the side. Um, so that's how that's stabilizing the knee. Moving on, so I actually do have a tangible project, but it is very hard to see. Um, so I did go ahead and put it on the slideshow just for better visibility. But to let you know that it is tangible, I have it um, in my hand. um, so this first image here, I have drawn every thing on the poster board. Um, I did get all of these drawings from the textbooks as their images in the textbooks, but I wanted to draw it so that it's noticed that I did actually do it by hand. So this first one is the anterior view of the right knee. It just shows super simple femur, patella, tibia, and the head of the fibula. Okay. Next is the posterior view of the knee. We have a little bit more going on in this one. On this femur, we have the lateral epicondyle of the femur. We also have the medial epicondyle of the femur and the adductor tubercle. And then for the fibula, we just have the head of the fibula once again. And of course, we have the back of the tibia. The next one is going to be our lateral view of the knee. This one is very much more detailed. I did color it, trying to indicate certain wording to the color. So up here we have the quadriceps, which again are anterior to the thigh. So we can assume that the posterior of the thigh is going to be the hamstrings. We also have the patellar tendon, which is a super light gray piece. You can't really see very well, but it attaches the muscle to the patella. And then we have the bursa sac, which is in front of the patella. It's between basically the skin and the bone. It's filled with synovial fluid, and that just helps to lubricate the bone so that there's no friction. Again, we don't want friction. We also have a fatty kind of pad going on, and that's going to basically do the same functions as the menisci. So we have the lateral menisci and we have the medial menisci. Okay, so again, that's going to absorb the impact that we put onto the knee, and it also helps provide some stability. We also have the articular cartilage. So that's going to be this darker gray piece along the tibia. This is just another layer of smooth tissue to reduce friction. Um, We also have the patellar ligament. It's a light gray piece once again. It connects the patella to the tibia, providing stability and to help prevent misalignment. We also have the fibrous joint capsule. It's also in light gray, but that will help to keep the hinge joint and the synovial fluid all locked in place. It's a strong capsule, and it just helps embody everything. The synovial membrane is going to be in green, and the synovial fluid is in blue. Um, we know what the purpose of the synovial fluid is. The synovial membrane keeps the fluid inside. Um, and then, of course, the anterior cruciate ligament, which is right above this little tibia here. We know what that's for to keep everything aligned, provide stability, make sure we don't hyperextend, so forth. A representation of the movement. Um, so in the video, the tibia, I actually move up and down. Downward is going to be the bending of the knee, the extension of it. And as I move it upward, it's going to be straightening the knee and flexing it. I did cut little ridges into the ACL and the PCL, just to help it move better. Um, and you can assume that between the femur and the tibia that there is the synovial fluid, the actual joint, um, and the fibrous joint capsule. All of the things you can assume are between the femur and the tibia, as we have talked about it. I also put the patella up there just for accuracy. But yeah, so that is going to be it for me discussing the knee. I appreciate you following along. I hope you did learn a lot. Thank you once again. Bye.